Hey everybody, welcome. It's Dr. Jared Skowron from Spectrum Awakening. So the first thing to think about is back when your child was young. And this is one of my first questions that I ask my patients is I say, walk me through the first couple years of the life of your child's life and tell me what happened with their development. Now, most of the time, physical development is pretty on schedule with our kids on the spectrum, unless they've got some really, severe mitochondrial issues and you've got muscle tone issues and walking and crawling issues and those kind of physical things. Those are more mitochondrial. But when we talk about language, we talk about eye contact, and we talk about that awareness. It's a very intangible kind of thing, but hey, I know my child's aware. This is how aware they are. This is how they interact with me. And is that different or has that changed? So what I want you to think about is this, the first step that I like to talk people through. Autism, step one, okay? Was your child regressive? Or were they non-regressive? And what's the difference? Children who are regressive develop skills and then lose them. Kids who are non-regressive have these delays from birth. They never develop things that disappear. They're just, things have always kind of been slow since the beginning. So let me kind of describe the typical stories I hear from parents is that, again, number one, my child, we never got any language till they were like 3 or 4, and everything was always slower than average. Or I just talked to a patient just now who said, I thought something was off right from day one. The child was born like something's off, all right? If you think that is the case, then we have a child who is non-regressive, right? The typical story of the regressive case is my child's developing, we're babbling, we're kind of interacting a little bit, and then one day, normally between 12 and 18 months, but it can be any time, one day, bam, it all disappears. You're like, where did my child go? They're not babbling anymore. They're not looking at me anymore. Something's off, okay? So you've got to work, you've got to figure that out. Is my child regressive or are they non-regressive? Because that is going to guide you to the first analysis and lab testing you should do. So let me hold this back up. If you have a child who is non-regressive, oh geez, Skowron, what did you do? You know what I did? Hold on. I had a migraine this morning, so I mixed up my things, so let me correct them. All right, so if you have a non-regressive case, you've been delayed since birth, follow this arrow over here, you need serious genetic testing, okay? The genetic testing you definitely need are a chromosomal microarray, a CMA, and a whole exome sequence, a WES. Those two tests will analyze conventionally genetic conditions that cause developmental delays. And in my opinion, half of those are treatable, all right? A lot of people think, if my child has a genetic thing, I can't treat it. Many are treatable. So if you have a child, you think they did not regress, you think the delays were from birth, please get these two tests. You can ask your physicians. We have these tests on our website. Get those tests done, okay? Next, and somebody, Gurman asked a good question. My son's genetic tests were normal, so then what, okay? If your CMA and whole exome sequence are normal, you were not born with delays. It happened after the fact, okay? So then you have somebody who's regressive, developed skills and lost them. The only genetic testing you may want to do for them is called a SNP test. The SNP tests are things like MTHFR, COMT, MAO, PEMT, all these different letters. But basically the SNP tests like MTHFR are the genetic tests that tell us what makes us the individual, okay? What makes me me? What makes you you? Why are some people happy and some people anxious and some people sad and some people strong and some people this and some people that? That's just who we are and our uniqueness of our genetics, and we can look at that through a SNP test. The SNP test does not diagnose genetic disease, okay? Now, Amanda just asked, I'm going to grab this question, what about rare genetic conditions? Rare genetic conditions are going to be discovered in the CMA and or the WES. One of these two tests will find rare genetic conditions, and again, in my practice, half of these are treatable, okay? Don't know which ones are treated till you look at the genes behind it, okay? Next, what do we do after that point? Okay, after that point, we want to make sure that everything in the child's body, everything in the child's mind, all of their health and medical issues are running as they should, because that practically is kind of a summary of biomedical treatment. Now, biomedical treatment, if you haven't heard it, or the term functional medicine, and there's a bunch of different words that basically mean the same thing, we are treating the child medically. We're looking at their biology, we're looking at who they are, we're looking at what's not working too well or working too much, and trying to make things work as they should. Okay, that's biomedical treatment. Now, I've got a summary here of hold on, I'm looking at different pages that I've got. What did I do different here? Local lab. All right. Here we go. Sorry about that. A little brain fart. This is a drawing I had done a few years ago that highlight the different medical aspects that can be affected by autism, should be tested and should be treated. So we're going to walk through these and see what you think. So I drew a flower. We had a flower drawn and little puzzle pieces for autism. These are the 7 different medical aspects of autism that we look at. Number 1, autoimmunity. Number 2, brain chemistry. Number 3, detoxification, genetics, gut digestion, hormones, and mitochondria. Any of these things can affect our kids. Now, you may have one of these things affected, you may have all 7 affected, or somewhere in between, but you've got to do your testing on everything: the mitochondria, the hormones, the gut, the diet, digestion, candida infections, genetics, detox, brain chemistry, and autoimmunity, okay? So, you want to make sure you look at all that, and you want to make sure you are connected with a biomedical doctor that will do all of them, all right? One of my pet peeves about the biomedical world is that a lot of people focus on the gut. Now, that's great. Hey, the gut is one of these parts that need attention, but they all need attention, okay? Can you do the diets? Of course you can. Can you treat candida? Of course you can. Will that help you? Yes. But how much? 10%, 50%, 90%? Okay? Once that is, once you've kind of conquered one area of the body, and a lot of people talk about this, they're like, hey, we did XYZ treatments and I got from here to here, but now I've plateaued. Now, what do I do when I plateaued? Well, when you plateaued, you've basically exhausted a treatment, category, and you've got to move on to something else. So please make sure you test or work with somebody who will help you test and analyze and treat all of these different parts, okay? So let's talk about the testing that's involved. Now, again, this testing that we're going to talk about, you can get from your local physicians, and we have it on our website. So if you don't have somebody who can order it, you can order it through our website. We'll send you the test kits. You send in your samples, we'll get the results, and I will write a written explanation about what it means and what to do about it, okay? So whether it's through us, whether it's through your doctor, get these tests done. What tests do you want to do? Well, here are some examples of some tests that you can do. All right, well, which way do I hold this? Genetics. So we talked about the different genetics, okay? If you believe your child was born delayed, you may want to do the microarray and the whole exome sequence. Our test is a saliva test. Normally through other physicians, it's a blood test. And then the SNP testing for MTHFR and such, again, we do ours through saliva. So you want to get those genetic tests done. Also an OAT test. You may have heard of the infamous OAT test, okay? The OAT test is a urine test that analyzes certain chemicals in the body that can identify yeast infections, mitochondrial problems, and analyze certain vitamin levels, all right? Pretty cool test, very commonly done. Next, a stool test. If you think your child has digestion problems or some kind of infection like candida or bacteria or a parasite infection, if they have a big bloated belly, if they've got diarrhea or constipation, or your child's always pushing on their belly, okay, it probably hurts. So we want to take a look at the stool test for that kind of thing. A good stool test will also analyze your probiotic levels and your prebiotic levels, okay? Also mold, more of an issue than you'd think, especially when it comes to behaviors. If your kid has a lot of bad behaviors, okay? If they're always hyper, they're always stimmy, they're always jumping around, they're always screaming, it's normally an infection. It's normally pain, okay? Pain makes us upset, all right? So pain from an intestinal infection like yeast, pain from an intestinal infection of mold, okay? Or headaches. A lot of kids who head bang, it's because they have headaches, all right? So a stool test will help you analyze that thing. And of course, the mold test is a urine test that'll tell you if there's mold in a child's body. And when I first heard about the mold, I really didn't think it was an issue. However, more and more of my patients with really angry, aggressive behaviors turns out to be a mold infection. And when they did mold remediation in their house, child's mood got dramatically better. So mold is another thing to look for. Heavy metal test. There's a lot of toxins in this world, and many toxins such as lead and mercury and aluminum are known to cause neurological damage and developmental delays. So you got to test for those things and get rid of them. Mitochondria, okay, we can do some mitochondrial analysis through the OAT test, but you can also do a test called the mitoswab, which is a saliva test. You're going to get an accurate analysis of what's happening with the mitochondria right now and how to treat it. Different foods, there's different food allergies and food sensitivities helping you, decide what to put as for their diet. We do a food sensitivity test that's a finger stick. Well, they say finger stick, but I think that's kind of dumb because, boy, the fingers hurt more than anything. We just got to get a little blood on this piece of paper for the food test. Try the ear. Guess what? The ear doesn't hurt as much as the fingers for blood, or your heel. Okay, get that little blood from the heel and put it on. I remember I was at my daughter's pediatrician's office years ago, and they were doing the little finger stick for iron levels. And I was like, oh, can you do the ear? And the tech was like, whoa, what? I'm like, can we get the blood from the ear? It doesn't hurt as much as the finger. And my daughter's very nervous. She's like, I don't know if that's the same blood. I have to ask the doctor. I'm like, trust me, it's the same blood. Trust me. Okay, moving on. Also, other local lab testing. My patients, we will often send to Quest or to LabCorp or to hospital to get typical urine and blood tests. That can help analyze brain chemistry. We can do OAT tests through local labs, heavy metal analysis, carnitine analysis, PANDAS testing. The local labs now have PANDAS testing you can get done through the blood, even more than just the strep antibodies. They've got actual autoimmune analysis against the brain. So there's a lot of testing out there to do, okay? And why would we want to do some or all of those tests? Well, again, we want to figure out from a medical perspective what's going on with your child. And we want to know which of these parts of the flowers, which of symptoms, which parts of the body we need to support. Because as we support those parts of the body, your child is going to improve. The language is going to improve. The behavior is going to improve. The digestive issues are going to improve. The sleep's going to improve. All those things will improve when we give the body what it needs to function as it should. Okay, so that's how this biomedical thing works. How's the body not functioning? Let's get it functioning correctly. All right, how do we do that? Well, with different treatments and different supplements, different pharmaceuticals. My practice is all natural. We don't use any pharmaceuticals. Other people use pharmaceuticals and natural things combined. Everybody does things a little differently, but let me walk you through the different treatments that are out there, okay? Now, we're gonna kind of categorize, all the treatments. And again, this is very broad. This is very, broad, big picture outline to help you guys understand what's out there. So GI treatments, of course, we could do different diets. There's a myriad of different diets, whether that's gluten-free or dairy-free, etc. There's the histamine diets, oxalate diets, salicylate diets, okay? Different antimicrobials. You want to kill the yeast. You want to kill the bacteria. You want to kill the parasites. These can be natural things. These can be pharmaceuticals like nystatin or diflucan or antibiotics or metronidazole, all right? Probiotics, prebiotics, digestive enzymes, different things like magnesium or calcium to change your bowel consistency. Okay, this is kind of the broad category of different GI treatments. Brain chemistry, brain chemistry I think is so overlooked. Balancing brain chemistry is really the wheelhouse of my practice, and we get so much improvement in language and behaviors and sleep just from balancing brain chemistry, okay? Amino acids, that's the key, all right? The brain runs on protein. We got to get the right amino acids in there. And of course, all the different B vitamins that you're probably familiar with, folinic acid, methylfolate, different forms of B12. That's how we change brain chemistry, all right? Mitochondrial treatments. Now, let me take a step back. What are mitochondria? Mitochondria produce energy, okay? They are the powerhouse of the cell. That was the old phrase in high school, okay? Mitochondria produce energy. What needs energy? The brain and our muscles and everything else, but mostly the brain and the muscles, especially the heart. So when you don't have mitochondria functioning as they should, and they normally don't because of toxins, then you're not going to get your muscles working. What would happen? Number one, low muscle tone, fine and gross motor skill problems, and constipation. The colon, you want to talk about the muscles in the colon? Squeeze that poop out, squeeze that poop out. We play charades someday. This is poop, okay? So you want to make sure that the mitochondria are working. Also, seizures are caused by mitochondrial problems, anxiety, sleep problems, reflux, a lot of symptoms of mitochondrial issues, okay? ATP, the mitochondria produce energy in the form of ATP. You can just give ATP. Your mitochondria is not making ATP energy. Here you are, ATP in a tablet, all right? CoQ10, carnitine, creatine, alpha-lipoic acid. All these are all common mitochondrial supplements, all right? Hormones. We didn't really talk about hormones yet, but there's 3 different categories of hormones, all right? Now, most of the time I say hormones, you think sex hormones, estrogen, progesterone, testosterone, okay? Those, of course, are an issue post-puberty, but pre-puberty, we don't worry about sex hormones. We worry about thyroid hormone, and we worry about cortisol hormone. Cortisol hormone is so important when it comes to behaviors, transitional anxiety, and immune function. If your cortisol is off, it's going to affect your immune system. Okay, whether your immune system is overactive with PANDAS or PANS and autoimmune issues, or it's underactive and you have a lot of GI infections of candida and parasites and bacteria, all right? Next, and we use different herbals to treat those. Detoxification, okay? Our kids are toxic. We're all toxic. We live in a toxic world, okay? Different homeopathics, different oral chelators, different binders, different ionic foot baths, IV chelation, okay? A lot of different things to do to help with detox, like ACC, very common, chelation type of program that a lot of people on the spectrum use. That's the oral chelators, okay? Autoimmune issues. You've got PANDAS, you've got PANS, you've got other autoimmune conditions. You want to use different anti-inflammatories. You want to do a lot of gut treatment with those autoimmune and, of course, different hormonal treatments because that cortisol hormone is affecting the immune system. So we've got to treat the cortisol anytime we're treating any autoimmune condition. All right. And then, of course, there's general nutritional support because, frankly, most of our kids do not have great diets. Most of our kids are picky eaters. Are they going to have 6 to 8 servings of fruits and vegetables a day? Of course not. Who does? So we want to make sure we're analyzing different nutritional deficiencies because we can get symptoms from that kind of get mixed into our autism developmental delay kind of picture. Okay, and I think it was just a few weeks ago on another Facebook Live, I was showing some research studies about kids with autism going to the ER because they have scurvy. They literally have a vitamin C deficiency because they don't eat any fruits. Okay, so this is kind of a broad, overarching view of what's going on with autism. And again, this is how I work with kids in my practice is A, are we dealing with something genetically caused? Were you born with it? You've got to get those genetic tests done. All right. If you weren't and you had an obvious regression, it's probably toxicity induced. And now we've got to look at all these parts of the body, whether it's genetic or not, we've got to look at all these parts of the body. That's the key to biomedical. So we can look at their autoimmune issues and their brain chemistry and their hormones and their mitochondria and their detoxification and their gut and yada, 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 yada. Okay. We've got to look at all the moving parts. All right. So I just want to encourage you. Okay, whether you're doing this on your own, whether you're working with me, whether you're working with another doctor, okay, make sure you're looking at all these different parts biomedically, whether it's testing, whether it's treatment experimentation to help your child in so many ways, because there is so much out there. Now, I do want to review with you guys some of the supplements that we use and for these different categories, just in case you want to try them. Again, this is only the second time of the year that we do our big 25% discount. So if you're going to try something, frankly, it's now. All right, so let's walk through a few of them. We've got a lot of stuff, but I just want to pull out kind of the highlights. All right, here's the first one. I'm just grabbing what I have in the box here. Anti-inflammatories, okay? We have had many kids start on anti-inflammatories and they start talking. Okay, because if inflammation of the brain is preventing the language from happening, anti-inflammatories can help, and that can indicate that you may have a potential PANDAS or PANS. We have a supplement called Panda Bear. This is a natural anti-inflammatory because you don't want to use ibuprofen long-term because you're going to get an ulcer. So Panda Bear is a wonderful, tasteless anti-inflammatory. Great question here from Amanda. What's good for energy levels for us parents? We'll all get there. All right, number 2, brain chemistry. And again, brain chemistry and balancing brain chemistry is the way that I see most of my patients improve their language and behaviors in sleep. All right, so we use things like our Power and Focus. This is our number 1 supplement. Our Attention on the Double, that boosts dopamine, focus, and attention. My favorite product from last year, our Super Folinic Acid. Folinic acid has some great research stories about how it does improve language. And side note here, we do have some free courses on our website. If you're interested in learning more and interested in getting the research in your hands, go to our website, spectrumawakening.com, click the education tab, and go through the courses there. There's one on MTHFR and folinic acid. There's one called The Story of Autism that talks about regressions in genetics. Watch that stuff, absolutely free. We want you to learn to help your kid. All right, moving on. What else do I have here? Oh, here's another one. Those kids who were very hyper, calm and cool. That's a great one. And my favorite for sleep, I use this with my daughter, is super serotonin support. Next, again, we talked about mitochondria, and this is a very unique substance. I'm glad we were able to bring this into our office. This is ATP, okay? ATP is what mitochondria make as energy. There's many products out there that have the term ATP in their name, but they don't actually include ATP in the ingredients. So if you want ATP, you gotta get it as ATP. There's a handful of products out there, but just make sure you're looking. All right, next is detox. Again, there's a lot of different ways to detox out there. What we have as unique is a homeopathic that we produced called Shot Support. This specifically helps remove and support the normal excretion of mercury and aluminum from the brain. Okay, next, what do I got in here? Let's talk about killing gut bugs, because I know a lot of people are concerned about candida, bacteria, parasites. It's a real thing, okay? And the backstory of how this happens, we inject toxins into our kids. The toxins affect the mitochondria. The mitochondria produce energy for the immune system. The immune system keeps these infections away. So if you've got the toxicity and the mitochondrial problems and then the immune system deficiencies, then you're going to have these yeast infections, bacterial infections, and parasite infections that last forever. I mean, how many of you have been on nystatin or diflucan for months to years, and you stop it and the problem still comes back? Why didn't the immune system take care of it in and of itself? This whole part of the body needs to be treated, not just the gut. We have a multitude of different herbals to kill these things. We have grapefruit seed extract, wonderful, dissolves well into sour things like orange juice. We have essential oils, oregano oil, ginger oil, and fennel oil in a soft gel. You gotta swallow this pill. It's called No More Mr. Fungi, because yeast are fungi. And then our newest product from a couple weeks ago, which I love, you've gotta be able to swallow pills. This is our parasite product, Paraslayer. It'll also work for yeast and bacteria. It's amazing, I love it. And a lot of kids, if you have a bloated belly, you want a digestive enzyme. So, we have a chewable digestive enzyme. Last but not least, and again, this is only a sampling of our very common supplements. We've got a lot on our website. We are adding more gummies. You guys asked for more gummies. We've got more gummies. So again, gummies aren't the best way to get stuff in the body because there's a lot of sugar. But guess what? If your child won't take anything else, I'd rather them have something than nothing, all right? So we have gummy omegas. So we have an omega 369. This is vegan and it's gummy. We also have a vitamin C gummy. We have an elderberry gummy, and we have a vitamin D gummy, which we call Gummy Sunshine, okay? Those are the gummies that we have. My daughter tasted them all. My daughter says, this one's the best, Dad. I like my vitamin D gummy. Okay, but I'll snack on these way too many. A bottle of this will last like a week in our house. Okay. Let me stop there. I just kind of had diarrhea of the mouth. Let me stop there and sit back, review, and answer some live questions. Okay. Autism is a big struggle. It's a lot. Okay. And some kids are high functioning, and some kids are low functioning, and some kids are in the middle. But what we've got to do is help each and every child. And the first step is figuring out, was your child born with it, or did it happen after that? Okay. And again, is my child regressive? And we've got to work on detox and a SNP genetic testing, or did they have delays from birth? And we got to work on a microarray and a whole exome sequence. All right, that's where you've got to start in your mental process. Then we've got to look at our child and say, hey, now I've got to figure out what part of the body medically is affected. All right, is there an immune system issue, a hormonal issue, a gut issue, an infection issue, a brain chemistry issue, mitochondrial issue? We reviewed all these. Get your testing if you want. You don't have to. Try the treatments. Okay, you don't have to do the testing to try the supplements. Try the supplements if you want. You like tests? Get the testing done. Whether it's through our website, whether it's through your doctors. Okay, but we can get there. we can help your kids improve and feel better and feel happier, and the whole family's going to get better. I mean, how many of you are walking on eggshells because you've got to do the exact right thing for your child, or they're going to have a temper tantrum, honestly, okay? We want to help you have a happier life and have your child reach their full potential, which is a corny saying, but we want to get them as good as possible. That's the bottom line of it, okay? So I think that's a good summary for now. Again, the whole biomedical summary is a lot of moving parts. Make sure you look at every moving part. Again, with your doctor, with me, on your own, get it done.